So welcome everyone, and welcome to Empowering DNP Educators, leveraging Intellectus360 to meet 2021 AACN Essentials. I'll just put out to you, we have Melissa and Ashley are kind of fielding questions. So if you have any comments or questions, feel free to just put them in the Q&A section. Okay. And so today's agenda, really, I'm going to be talking about a few things. So streamlining the statistical process, that is in that data analysis, enhancing your skills, and then there's courseware that I will be talking about briefly, and that kind of takes care of some of the Intellectus statistics tool and courseware. And then with respect to the qualitative, we have improving qualitative analysis, facilitating research insights, and courseware for the qualitative. And then I'm going to tie those two tools and courseware together to align with the essentials. I'm going to talk about 5 basic kind of example applications of it, do a demonstration, and then conclude with some comments about benefits, and then open it up to you all. So that's kind of the agenda for the day, and let's just get to it. So Intellectus Statistics, or IS, is user-friendly. So Intellectus offers intuitive and easy to navigate interface, and it's accessible for all skill levels. This reduces learning curve and allows users to focus more on the analysis rather than on navigating complex software. 2, the software automates many of the routine tasks in data analysis, like data cleaning, finding out what the assumptions are. That's all preloaded, and it interprets the output for you. And that automation will obviously save time and reduce the likelihood of human error. The advanced stats techniques, Intellectus provides access to a wide range of advanced statistical methods, everything from like descriptives to structural equation modeling and mediation and moderation. So it enables users to conduct sophisticated analyses that would be really challenging for them to perform manually. You can customize the output. It's downloaded into a Word document that you can edit. However, everything is formatted in APA format, so that's great for faculty and students, that it's going to put everything in APA style tables and figures, which is going to save time as well. And there's collaboration features there. So Intellectus supports collaboration, allowing teams to work together on data analysis projects. And the feature is particularly useful in education and research settings. And finally, for the resources, Intellectus offers a range of educational resources, including tutorials. There's 60 videos, webinars like this, documentation, and so forth to help users develop their statistical analysis skills. The Intellectus qualitative, for number 1, for their advanced text analysis, IQ, or Intellectus qualitative, offers sophisticated tool for thematic analysis. The tool will definitely help researchers identify the patterns and the themes and the relationships in qualitative data more efficiently. The platform definitely streamlines the manual and AI ability to code in the tool. So we really up that game in terms of having AI assist in that naming and describing of those excerpts. That is encoding. Soon, there's going to be a search feature that allows researchers to code a large volume of text all in one swipe. So that's going to be out within the next month, for sure. Again, easy user interface. We designed IQ to be a user-friendly interface, making it accessible, again, for researchers of different levels of experience in qualitative analysis. And that ease of use is going to really accelerate and flatten that learning curve and enable researchers to focus more on the analysis rather than on the tools. As in Intellectus statistics, there is a collaboration feature there that allows multiple researchers to work on the same project, to import and export code books, which is helpful for research teams. There is a automated transcription service. So built into the tool, the researchers can transcribe audio and video data, pretty quickly. And that's going to reduce time and effort and required for manual transcription. And as in Intellectus statistics, IQ provides comprehensive support and training resources, including tutorials, webinars, customer support to assist researchers in maximizing the use of the platform. These are some of the lessons or courseware for each of the quantitative and the qualitative tools. These are all competency-based. There's 20 in the in the qualitative bucket, and about 60 and counting on the quantitative bucket. So these are all used to kind of upskill, or certainly if you use them in courses, those will go behind your learning management system, and the grades will just get transferred right to your grade book. Okay, let's tie these together with some of these essentials. So, excuse me. So, essential one, scientific underpinnings. Both IS and IQ facilitate a deep understanding of scientific underpinnings in nursing practice by enabling advanced analysis and research capabilities. They support the application of complex statistical and qualitative methods to nursing research, which is really critical for evidence-based practice. For Essential 2, organizational systems leadership for quality improvement and systems thinking. These tools aid in the analyzing of data related to healthcare systems and patient outcomes, thereby supporting leadership roles in quality improvement initiatives. The ability to interpret and apply data effectively is key to systems thinking and decision-making in complex healthcare environments. For Essential 3, for clinical scholarship and analytic methods for EB practice, Intellectus statistics, advanced stat capabilities, and IQ's analysis tool really together with the courseware directly contribute to clinical scholarship. I mean, they'll enable DNP faculty or PhD faculty and students to conduct rigorous evidence-based research, which is essential for new nursing practice and policies. For essential number 4, info systems and technology and patient care technology for the improvement and transformation of healthcare, both Intellectus statistics and Intellectus qualitative really embody the integration of information systems and technology in healthcare. They both demonstrate how technology can be leveraged to improve patient care and healthcare outcomes through sophisticated analyses. The Essential 5 healthcare policy for advocacy in healthcare. The insights derived from the data analysis using IS and IQ can inform healthcare policy advocacy. Understanding and interpreting data is crucial, obviously, for advocating for effective healthcare policies and reforms. Essential 6, interprofessional collaboration for improving patient and population health outcomes. These tools can be used in collaborative research and projects that involve multiple healthcare disciplines, which really fosters interprofessional collaboration. Essential 7, clinical prevention and population health for improving the nation's health by analyzing population health data and trends using IS and IQ. DNP and PhD faculty and students can really contribute to clinical prevention strategies and public health initiatives. And finally, Essential 8, advancing nursing practice. Both IS and IQ support the development of advanced nursing practice by providing the tools necessary for comprehensive data analysis, which is integral to developing advanced clinical skills and knowledge. So some of the examples that these can really apply to, I just took a few examples of improving patient outcomes through data analysis. Certainly, hospitals really care about patient readmission rates. So really by applying stat methods and identifying those factors to readmission, you can seek to reduce those readmissions, particularly within 30 days. And IS's role was really to facilitate those patterns and correlations to enable more effective decision making. With respect to public health research or analyzing behavioral trends, research can use IQ to analyze qualitative data from interviews and focus groups to understand, the public attitudes towards vaccination, for example, of which there are many. Those insights can really, the insights gained from these informed public health campaigns can really improve vaccination rates. And certainly IQ's role can be in the extraction of themes and sentiments from that qualitative data, which provides deeper insights into public perceptions. With respect to nursing education, integrating data analysis into the curriculum, nursing schools and, I'll say larger colleges that seem to be the direction, can incorporate Intellectus statistics into its curriculum. Then it's going to allow the students to really engage in hands-on data analysis. And the approach definitely enhances students' understanding of evidence-based practice and research methodologies. Mental health services evaluation. So mental health clinics can use Intellectus statistics to evaluate the effectiveness of different therapy programs. They can analyze treatment outcomes statistically. The clinic can identify the most effective therapies and optimize for its services that it will provide. And Intellectus's role will be in our statistical analysis to measure and compare outcomes. And finally, with respect to community health assessments, community health assessment using qualitative methods, health organizations can use Intellectus to conduct a needs assessment, analyze those community interviews and surveys, and then identify those health needs and develop targeted health programs using those interviews. Certainly, IQ can assist in analyzing that qualitative data to uncover community health needs and priorities. So I think now I'm just going to jump to the tools themselves, and I'll just move this. So let me just get this over here. So let me just move this here. So I'll just jump into the Intellectus statistics tool. Change screens. So let me just jump to, well, let me just say a couple things. So the short version is that students and some faculty really struggle with three core things, which is, what do I do? How do I do it? And what does it mean? So we have a decision tree built in, which you can walk along the tree limbs, so to speak. But I have this little handy kind of layperson's questions. I want to predict an outcome that scale. I'll be doing a linear regression. So let me just restart that. So I want to predict an outcome that scale. Oops, go back. That scale. And so linear regression is the analysis. I think my data is loaded up. That's my problem. So first you have to load data up. All right, so here. And so one more time. So once I have linear regression, I could just go to conduct analysis and I jump right into the test. And here I simply just select the DV, in this case, GPA post, and the IV, GPA pre. Just put the variables in there, hit calculate. And what comes out is an interpreted output. So it preloads those assumptions, one of which is normality. You can scroll over to see the interpretation of that. In about a month, we will have AI interpreting that for you. So if there's non-parametric tests to be had, we will be suggesting those or just automatically running those. More assumptions with scroll over, outlier analysis, and then the results are in plain English. So now this is a template for your results in 2 seconds. By the way, for DNP students, and I'll do a pair t-test as an example, it typically takes them 2 to 4 weeks to run that test when they're doing descriptives and pair t-tests. So you can see the results though, the model is significant. And then when there's a significant beta coefficient, as there is here, there's an interpretation of that inside of an APA table. I'll just run a pair t-test because it's just so common for a lot of folks. Again, I just select the test, put in the variables, and hit calculate. It just streamlined. So again, the assumptions are built in. There is a use case for, well, let me talk about research for a moment. It's actually running the test and interpreting that test for you. Results are again in plain English. You would have to edit that document. You can use the APA table straight up, and you can see the interpretation here that once we know that that T is significant, we just need to interpret it, and you have the appropriate plot and table sitting there, all downloadable to a Word document. As I mentioned about the assumptions, when assumptions are violated, quantitative assumptions at the moment, but we'll have graphical assumptions violated, and then jump to that non-parametric. So here we didn't ask for the Wilcoxon, but you can see that it was ran and the appropriate plot and the actual interpretation sitting there. And then all, as I say, downloads into an editable Word document. Excuse me. So a linear regression is sitting here, APA figures, APA tables, and then the interpretation. And then if I jump to the pair t-test, again, assumptions. I was going to say for the use case for teaching, certainly it's teaching students about what the assumptions are, the name of the test, and then how to interpret that. We have plenty of example data sets curated for healthcare that they can practice on. APA tables, the not asked for, but needed Wilcoxon. And then APA style references for all the in-text citations, and then a curated glossary of terms and symbols for the tests that were conducted. In this case, the regression, the pair t-test, and the Wilcoxon. Okay, lots of other stuff in here. Typical data management. Well, let me just say other things. Upload different file formats, example data sets, typical data management tasks, typical plots, 10 typical plots, including control charts, which have rule sets that are interpreted. I'll get the words out. Okay. You saw the decision tree, data plans that for methodologies or for IRB, power analysis built in. So you don't have to go to G-Power or figure out pass or something. Just select the test, and then you can have a downloadable and editable sample size. Okay, and then there's video libraries and manuals all built in. I will add one other quick thing, which is we just added a data cleaning feature. Occurs to everyone doing data analysis, 90% of it is data cleaning. So if I go to upload a file, excuse me. So we have a data cleaning wizard that that you jump in. If you upload data from Qualtrics or SurveyMonkey, there's often several rows of headers. You could just go ahead and delete those rows of headers and go to the next shot and then update variable names on the fly. I need to update that. I can merge sometimes that there's misspellings or miscapitalizations. Here I disagree with three E's versus two E's. I can just merge, review, merge, and then see the before and after merge. I do have Likert scale items, so you could just select from one of the scales and it shows you the before and after. And I'll say I want to change all of those from really basically labels to numbers because I'm going to need to combine them. And then I'm going to add a subscale, which is, let's just say these three items are a total, let's just say COG, okay. I want them averaged, and item 3 is reverse coded. My scale goes from 1 to 4. Creates that subscale for you on the fly. And we suggest, add an ID variable. And that's it. So in 2 seconds, well, a little bit longer than 2 seconds, you can clean up your data, get it in the mode that you need, and then have subscales in the appropriate order. And you're ready to jump into those quick analyses as I just showed. So, and I did mention the sharing. So you can click share here and share it with colleagues or students or whatever. And just click to share, put in your email address, and then they get notified. You're sharing a data set, and here's kind of notifications. They've accepted it or not, and the email gets sent to them and so forth. So that's basically the Intellectus statistics tool. The Intellectus qualitative tool. So here we have much more AI infused here. You can create a project, and when you do that, we request that you put in the purpose statement and research questions. So when those codes are being AI generated, we're going to tap into that additional context. When we have a project created, and I can, so that's fine. So I can upload data through PDF or text files. I can, as I stated in my presentation, transcribe audio or video files, or just start typing a blank transcript in. Here I have Ethan's transcript here. I've done some coding, but let me just bow out of these for a second. So here I have a blank interview. So I can add codes either manually or with AI. Okay. And I can add a code manually, like burnout. I can add a description here. And now I have my code. I can now assign a excerpt or an interesting passage to that code by just clicking it. And that ties that code to that excerpt. I can also use AI, excuse me, to create a code name and theme, a code name and description, pardon me, by selecting a passage, going to add code into AI Assist. And now what we're doing is having an editable code name and code description that is there. Analogously, I can add a theme manually, okay? Theme example with description. Or I can use a AI to do that by clicking add theme, going to AI, selecting the codes that I think go together for that theme, and letting AI generate a theme name and description, which is both editable. So there's a manual and AI assist with the code, and is an AI manual assist with the theme. And then simply to associate codes with themes, you just scooch them up into it, drag them into it. So you can see it's very simple to use. There is a memo log that is memorializing all of the uploading, the coding, the thematizing. It's capturing all of that data. And I'm going to jump to a different project. So these are just 3 interviews that have codes and themes. We go to insights and clear. One of the things that is really challenging with qualitative or thematic analysis is really looking at the inter-rater reliability. So what we've done here is, so in the, to go get inter-rater reliability, we have to go get other raters, train them, and then score their agreement levels. What the tool is doing right now is it's looking at every single excerpt and saying, does it agree with the theme that's associated with it, or does it better agree with something else? Okay. So, and it's doing that 3 times for every single excerpt. So what has just shown up here is that for every single theme, we have an average kappa coefficient or level of agreement there. So when students and faculty and researchers are going through the thematic process, I can see if I'm on beam or not with respect to, hey, my excerpts, codes, and themes are lining up, or they're not. That is, if I have slight agreement, I might want to go back and revisit that. Or if I'm doing really well, hey, gosh, I have substantial agreement, I'm on being great. So it's good during the thematic process, one, but it's also good to the insights document is starting to prepare your document for publication or dissemination. In addition to the kappa coefficients, we have theme descriptions. So I can select a theme, work-life balance, select the representative excerpts I want to go with that. And in short order, I have, again, building that results document of the theme name, the theme description, the codes associated with that theme, and then this is my supporting excerpts. I can also just add my memo list to show what's been happening, and my excerpt list if I want. I'm just going to highlight 2 other things about what's coming in about a month, 4 weeks, less. And we'll give a whole presentation about qualitative in about a month. So under the search feature, what's going to happen is we have a search of the term, but AI is going to look for those synonyms, and then it's going to tag your entire set of transcripts, 3 pages or 350 pages. It's going to tag those where I can now go through and tick off and to see which ones are associated. I can read those. Let me say that again. I'm going to be reducing my data set and highlighting where those particular passages are identified, or particular phrases are identified in the excerpts, making that process simpler to start coding. because that's the bear of the work. You have to read them all, but again, it's reducing it from 30 pages or 130 pages to, tick, tick, tick. The other search feature that's forthcoming is under the codes themselves, where a button will now look for that, take that code and search the entire set of transcripts. Again, shrinking that data set down to manageable, to look at every code and to see where there are associated excerpts in the transcripts. Okay. All right, so let me go to the next. So what are the benefits of Intellectus statistics and Intellectus qualitative? So the enhanced data analysis capabilities, certainly the two tools are sophisticated for both quant and qual data analysis. It's going to enable all users to perform really kind of complex analysis with greater ease and accuracy. It's going to be beneficial in healthcare and research settings where data-driven decisions are really crucial. There's a huge time efficiency and accuracy component to both of these. The automation features in IS streamlines the data analysis process and significantly reduces the time required for statistical computations while enhancing that accuracy. This is vital in the field of healthcare, where time and precise data analysis really can impact patient outcomes. Improved research quality, IQ's ability to deeply analyze qualitative data, like interviews and focus groups, will lead to richer insights and a more comprehensive understanding of their research participants. The depth is essential in fields like nursing and public health and mental health, where understanding human experiences and perceptions is really key. Facilitating evidence-based practice. Both IS and IQ play a critical role in promoting evidence-based practice. By enabling the analysis of a wide range of data, they can help healthcare professionals and researchers make well-informed decisions based on solid evidence. Collaboration, the tools really support interdisciplinary research and collaboration by providing a common platform for data analysis. It's, again, especially important in healthcare, where collaboration approaches are really needed to address complex patient care and public health issues. User-friendly, you saw how both tools work. Learning curve is really, really flat on both of them. So you can just really jump in. They're accessible to users with a wide range of levels of expertise, and it really democratizes data analysis, both quant and qual, by allowing more individuals to participate in the research and decision-making processes. And with respect to policy and decision-making, the insights derived from IS and IQ analyses can really inform policymakers and organizational decisions, especially in healthcare policy and administration. These data-driven decisions are really crucial for developing effective healthcare policies and improving healthcare systems. Terrific. Thank you all for attending, and I hope this was informative about tying some of the tools to our, to Essentials and making that more easily put together. So thank you all so much for your attendance, and have a great rest of the week.